All right, universal healthcare. It is something that everyone has their own thoughts and feelings about. And for that reason, I'll be talking about it today. So, first of all, I'll be explaining to you what it is and the differences between that and our insurance system. Then we will be talking about how it would affect most people if put into place, followed by the overall downsides and what the negative parts to the system. So, all that being said, let's get into it. Universal healthcare is a system that uses taxpayer dollars to fund treatment, appointments, etc., and pay for medical needs and other stuff like that. But it doesn't cover everything. So, a lot of the times there will be a small co-fee in some countries, or you have to pay for take-home medical equipment. But overall, it does pay for quite a bit of what insurance does in the US. And the difference between universal healthcare and the insurance system that we use in the US is for insurance, you have to pay into it or have a job that comes with it to be covered for anything. Those things can be really expensive compared to what it'd be like without insurance. For example, a neck brace costs $20 to make, but if you can be billed over $150 for it if you don't have insurance, which is pretty wild when you think about it. And given most of that is in America, and a lot of that comes from insurance companies constantly demanding to lower discounts, get higher discounts. So, all right. And the next one is how it would affect the people if it was put into place. So, universal healthcare. It costs a lot to put into place, especially with how much it takes to close down all for-profit medical companies and convert to all non-profit medical companies all across the US, and taking away all private pharmacies, doctors' offices, or anything in that nature, which is a form of government regulation which the US has a tendency to not really like all that much. So that is one of the main reasons why it hasn't been instilled here yet. Another way it would mainly affect us is that it would very much heighten tax, and many people wouldn't want to do that, even if it were helping other people, because it's a high cost to them, and that's no judgment. And overall disadvantages of universal healthcare, that the sickest people benefit the most from it, and everyone pays the most for the same amount of health coverage. And, well, people who are well most of the time or have good immune systems hardly benefit from it, or at least not much until they get horribly sick or something terrible happens to them. But you still have to pay the same amount no matter what your situation is. That's something not a lot of people like. It also incentivizes some people to be sick and try and get the most out of their money, which can lead to overuse of prescriptions. Anyway, I hope you've learned a lot from all of this. How universal healthcare can benefit and not benefit communities It's pros and cons, like every system. It does have them. And I wish all of you can use this to your advantage.